little bit. But Ryan has been lecturing about this topic for a while as well, but he's been lecturing about the brain and other really awesome things for a very long time. He actually created what's called Brain Chat online. And so you can actually check that out on thebrainchat.com is the website. So it's thebrainchat.com. But I'll let him introduce himself here in a little bit. For those of you that don't really know me, so I'm Dr. Brandon Crawford. I'm in Austin, Texas, or just outside of Austin, Texas. My licensure, I'm a doctor of chiropractic, but also have a specialty in functional neurology and a subspecialty in developmental functional neurology. I've been using CBD and CBD-based products for a very long time in the neurology world and health and wellness world. So definitely wanted to, shed some light on this topic for you guys, because there's a lot of really cool information out there. There's also there's a lot of myths out there too. So like I said to begin with, we're going to talk about CBD, but CBD is just one of the cannabinoids. A cannabinoid are all the different phytochemicals that are in the cannabis plant. Obviously, yeah, you like that, Boytums? Obviously most people know about CBD. They also know about THC, so on and so forth. But, to date, I think that we've identified about 140 different cannabinoids. I've heard either 140 or 160. So there's a lot of these suckers out there. And obviously what we want to do is we want to use a product that is what we call a broad spectrum or even a full spectrum product. And, we'll kind of talk about the differences of those. But, one thing that we may not want to do, we may not want to use like an isolate or a distillate type of product where it's really just, like one of those cannabinoids extracted in the product. So while those can be useful in certain situations, it's been my own clinical experience that we really get a better effect if we have all these different cannabinoids used together. So that's actually called the entourage effect as well. So, my own personal story here is that, I basically had given up on using CBD just simply because I didn't really ever feel anything from it. I never really felt an effect. I'm kind of the guy that my mind never stops going. I have a hard time falling asleep at night. I'm just prone to constantly think. And I'll stay up at night until 1 or 2 in the morning, just simply because my mind won't turn off. And, I've tried various types of CBD and other products in the past. Nothing ever really helped. The difference was whenever I started using a higher dosage product, I actually found that it started to calm my mind down. And that's whenever I was able to get more restful sleep. I just felt that brain fog kind of go away and that kind of stuff. So, that's my own story. And then I don't know if many of you have heard the story that I've told with my own son. He and I both have Tourette's. You wouldn't know it because, of the functional neurology that we do. We keep, myself and him balanced. And so we don't have the tics and all the things that come with that. But one thing that I noticed is that with this COVID flare, I call it the COVID flare because several of my Tourette's patients have had this issue where their tics kind of increased over this whole social distancing thing and all the stress involved. I noticed that when I gave them the high dosage of CBD, it actually brought those tics down faster whenever I was doing all my therapy. It only took a few days to really get them out of that little thing, that flare up, if you will. So, that's what I've noticed. That's my story. The way that I like to talk about the cannabinoid system is this. So I talked about the cannabinoids. So that's CBD, that's THC, that's CBG, CBD, all these different things that make up the cannabis plant. So those are the cannabinoids. Inside of us, we have what's called an endocannabinoid system. Now, here's how I want you to think about it. I want you to think about this like the same way we think about vitamins and minerals and nutrients, simply because this isn't, something where you start taking it and it's like a medication. We want to see an effect ASAP right now. This is much more like, this system needs to be supported. Just like when you start taking vitamin D or vitamin A or zinc or selenium or something like that, these nutrients start to support all the biological processes. They start to have an effect on the cellular receptors, and that starts to alter physiology. So the cannabinoids have the same effect on our endocannabinoid system, and our endocannabinoid system is very far-reaching. Dr. Cedermark here in a little bit is going to introduce himself, and he's going to talk about, a little bit more specifics about this in the brain. But what we know from the literature is that the endocannabinoid system has an effect in our brain, in our gut, our entire immune system, our inflammatory responses, our reproductive health. We have the system everywhere. Hey, that's okay. Cool, you're good, thank you. So we have the system scattered throughout our entire body, which is so cool. And that's when I, really started thinking about this as more of a nutrient perspective, something that I want to take constantly to support this, all these different biological processes and whatnot. So that's, how I really want you to start thinking about it. I mentioned broad spectrum and full spectrum. So I will stop here and say this, that both Ryan and myself do have ownership in a label, which is the Stay Strong Johnny Grant label. So basically, and then obviously I want to have full transparency with that, because, our goal is not to sell a product. Our goal is to educate. And, we obviously support, the use of whatever products that you want to use. And our goal is just to, give you some insight on how to use it, why to use it, that kind of thing. But we can talk more about that later. But, we have what we call a broad spectrum product, which is where everything from the cannabis plant is inside that. However, in ours, we have fully extracted the THC. So the THC is the component that is psychoactive. So that's the part that, gives you the high, if you will. So the product that we have actually is what we call a broad spectrum, which is where they have extracted the THC component, but it still has all the other cannabinoids in it. So there's that. So, at this point, I'm just going to, let Ryan talk for a little bit. So Ryan, you want to introduce yourself and then tell us a little bit more information?
Sure. Hey, everybody. My name's Ryan. I live in Atlanta, Georgia, and I'm also a chiropractor with a board certification in functional neurology, and I'm a family nurse practitioner. So I'm currently working in Atlanta as a family nurse practitioner, doing mostly orthopedic stuff, but working with pain patients. And that's kind of where I fell into learning more about CBD and the benefits of CBD on the brain and the body. Because before I got into family nurse practitioning, I guess you'd say, I worked with a lot of traumatic brain injury patients, so concussion and sports injuries. And my question in doing neurological rehab exercises was always, if there's a brain injury, what's really happening inside the body, and how can we provide the body what it needs to help heal? And what I found, especially with any type of injury that was brain related, was that it would cause inflammation throughout the body, and it would kind of off balance or off kilter the relaxation side of the body, the parasympathetic side, and start to ramp up the sympathetic side of the body. So what I really wanted to learn about CBD was how it could affect inflammation in the system, and then also how it can kind of turn on areas of the brain that would turn on more of the relaxation areas of the nervous system and shut down those unwanted sympathetic responses. And the more I read about CBD, I just kind of went down a rabbit hole with the research and learned that we do have this huge system throughout our whole body with receptors on basically every tissue in our body, which means that when we put stuff into our system to activate those receptors, we can activate those tissues, and it can have a pretty profound effect on the whole body. So that's kind of why I started learning about CBD, because also, working in as a family nurse practitioner, we do learn about all the medicines, and then you learn about all the side effects. So I'd seen so many medications that were taken that were causing lots of unwanted side effects, and to a certain extent, sometimes unnecessary side effects that would even throw the body and brain off a little bit more. And the more I read about CBD, there's there's still a lot of research to be done, especially with CBD oil. But from what we know so far, there's really it's a very low side effect profile supplementation, which really kind of attracted me to it. And that just further led me into learning more about it and how it could positively impact the brain. And really for me, it's all about the inflammation, because I think anytime there's injury to the brain or body, we suffer from unwanted inflammation, and CBD seems to really counterbalance those inflammatory responses. So, yeah.
Yeah. Now, didn't you say that you were just reading a paper about was it CB1 receptors on the vagus nerve? Isn't that right?
Yeah. So if you think of, like, when we talk about the endocannabinoid system, think about it as like another system in your body. So you have your musculoskeletal system, your cardiovascular system. This is just a whole other system that hasn't really been touched on, especially in medical school. I never learned about it in chiropractic school. I never learned about it going through my family nurse practitioner program. So the more you learn about it, you learn that there's receptors all throughout the body. You have specific receptors for the brain, and then you have specific receptors for the muscles, specific receptors for the gut. And one that's really interesting that I started reading about was what's called the CB1 receptor. So far, there's like two really well-studied receptors. It's CB1 and CB2. And taking CBD oil doesn't directly affect those, but in kind of like a roundabout way, it activates those receptors. And regarding brain injuries, I've worked with a couple of patients where their vagus nerve, or what I call vagal tone, has just been totally skewed and altered. And CBD seems to activate the receptors on the vagus nerve to kind of help increase what's called vagal tone. So yeah, that was one of the things that I read, but there's so much stuff. It's a very interesting system, and kind of like I said too, it's amazing how low the side effect profile is, and that's what really attracted me to learn about it.
Right.
I think someone's
Hey guys, there you go. Thank you.
Yeah, okay, I just muted. Okay. Yeah. So yes, there's receptors, and those CB1 receptors are throughout the brain, and they impact memory, they impact cognition. So, when you have yeah.
I think someone's not on mute, and their picture keeps coming up, and if you're not on mute, then I don't know if I can use this recording because their faces keep coming up. So make sure you please put your phone or your computer on mute. Sorry to interrupt.
Okay. No worries. But yeah, I don't want to bore everybody too much, but that's how, because I also, like, I grew up, I have ADD, ADHD. I also have autoimmune disease, Hashimoto's. So I'm always trying to learn about how to positively impact the brain. I don't take medication. Luckily, I was just never put on it, but I also had to figure out a way to get through school. So that's how I got into the neurological exercise stuff. But then from a supplementation standpoint, CBD just seems to really work well for me. And that's kind of what drove my interest even further, was the personal benefit that it had. And like Dr. Crawford said, a lot of the researchers that are very heavily involved in cannabinoids and cannabinoid receptors and their positive impacts on the brain, they say that they consider it an essential nutrient to your diet. So it's just pretty cool. And I didn't really know that much about it until about a year ago. And now I just read a lot about it.
Absolutely. And, the reason why I asked you to bring up the vagus nerve is because that's so interesting, because, obviously the main audience tonight is, brain injured kiddos. And so from my experience, I've worked with several pediatric brain injuries at this point, and I noticed that the vagal system is damaged in pretty much every single kid that I've seen, some to more extent than others. And, that's going to, integrate in the lower parts of the brainstem, the pons, the medulla, those types of areas. And so if we have a window into that system, it can be huge. Not only can it stabilize that system, but it can actually start to heal it. And let me just kind of talk a little bit about the vagal system, if that's okay. So your vagal system, obviously it centers around the vagus nerve. And so the vagus nerve controls all your organ function, your GI function in your gut, the ability to digest your food, digest excrete digestive enzymes, glands and organs, and all those things require vagal tone to work. But then there's more to that, because there's a higher order vagal system, and that has to do with social engagement. That's your ability to, read facial tone and know if someone's trying to attack you, or, if someone's your friend. It's, I'm sitting here using my hands and shrugging my shoulders. That's part of the vagal system. So a lot of the time, like, for example, if a kiddo is stuck in that fear paralysis reflex that we kind of touched on last time I spoke, a lot of times this vagal system is not working because they don't have that facial recognition. They can't see, the tone differences in the face, so on and so forth. And obviously there's other parts of the brain that, that influences, heavy right brain networks and so on and so forth. But, that's why it's so important to understand that these receptors are everywhere. And that if we can start to rehab the vagal system, huge things can happen, because that is such a big part of our well-being. Literally, that's 75% of our parasympathetic nervous system. And that's huge. That's our resting, digesting, healing system. So if we can just simply affect that, which the effects are much more far-reaching than that, then there's absolutely every reason to start taking this stuff. And like Ryan or Dr. Cedermark discussed, this endocannabinoid system is very far-reaching. It's in several different systems of the body, so it's definitely a good thing to be using. And obviously, if you have something that has a low risk profile, that's even better. So, Brian, did you want to say anything else before we started answering some questions?
I just wanted to touch on two things, because these are what I'm most interested when I was working with patients with brain injury, and then also just from a neuroinflammatory standpoint. Anytime that there's a bonk to the head, there is some sort of inflammatory response that's elicited by the system. And the inflammation is there for a purpose, but persistent inflammation is what I've found to cause lots of issues throughout the body. So it's very difficult to do really good exercises and do really good rehab for the nervous system when there's so much inflammation. And I kind of equate it to like trying to have a conversation in a thunderstorm. If there's so much going on, it's just all this loud noise within the system, it's very difficult to build a better brain. So that was one of my interests with CBD, is because what it showed, what the research actually shows with a traumatic brain injury, the endogenous system, which means your body releasing endocannabinoids, those little CBD receptors, they start to get activated in a brain injury, which means that it's using that system to try to shut down unwanted inflammation and pain receptors in the brain. So the research really shows that in a traumatic brain injury, the endocannabinoid system is activated to help shut down unwanted neuroinflammation and unwanted responses. But on the other side of that too, what I really enjoy reading about is what happens to the gut when the brain is injured. And what the research shows is that if there's an injury to the brain by ways of inflammation, by changes in the way that the vagus nerve communicates with the gut, you get what's called leaky gut. And the endocannabinoid system has a way of working around into the gut to help shut down a leaky gut. So that was another area of interest for me, because I worked with a lot of patients when I didn't really focus on the nutrition side of things, and it took a lot longer for the rehab exercises to kind of stick. And so what I found was trying to control the inflammation in a positive way and just kind of create a healthier internal environment really set the brain and the body up for success when you're doing those exercises. So you reminded me of that too. So.
Yeah, no, you're absolutely right. And, something that I actually thought of we haven't talked about, you absolutely knocked it out of the park with inflammation 100%. But then the immune system begins to kind of go into turmoil as well, because that's obviously a part of the inflammatory response as well. And so what we see oftentimes with brain injuries are the development of autoimmune disorders in the brain, where your own immune system begins to attack certain receptors or brain tissue or something like that. And same thing, if you can start to mitigate that, oh, darn it, someone's calling me. Sorry, I didn't turn that off. Okay, so you can begin to mitigate that, again, with something with a very low risk profile, a high safety profile. That's huge. And I love the demonstration or the example you gave of talking in a thunderstorm. That's perfect. I'm going to start using that. I call them roadblocks. If this chronic inflammation or neuroautoimmunity or something like that exists, that's a roadblock to care. You can do all types of receptor-based therapy or medication, but medication doesn't build the brain. But you can do all these things. But if you have chronic long-standing inflammation, if you have a disorganized immune system, you're going to have trouble getting the type of results that you could potentially be getting. So, you want to add anything else?
Just one more thing, just because.
Perfect.
Sorry, and then I'll stop talking. But with medication too, what I found is, and I learned this, like I went through the chiropractic program first, and then I went through the nurse practitioner program. And with medication, medication absolutely 100% serves its purpose, and it's absolutely necessary. But when you're using it to start to shut down systems and shut down unwanted symptoms, then that can begin to become an issue, because some of the medications that were prescribed, they're really not meant to be taken for chronic health conditions. So instead of shutting down unwanted symptoms through medication, supporting pathways and supporting systems with the essential nutrients and vitamins and minerals and CBD, stuff like that, that's where I found you're really just setting up your system for a little bit more success. And then also, you're able to regulate the entire body to a point where you may be able to eventually get off of some medication. So,
absolutely.
Yeah.
Cool. All right. So let's look at these comments here. We got a few.
How do you see those?
So top right corner.
Okay,
so someone just, this helps with severe global brain damage. The answer is yes. So my daughter, Hadley, was diagnosed with Lennox-Gastaut after suffering from an anoxic brain injury. She was prescribed Epidiolex from her seizures. Yeah, okay. Does not have THC. Should she take something with THC for LGS or the brain injury? So, the THC story is kind of tricky. And the reason is this. There's not a whole lot of good data out there that I've seen to support THC for seizure use. However, there is some information out there that says, yes, you can take, THC and it starts to regulate seizures. But obviously a lot of people are kind of hesitant to use it. My story with THC is, it revolves around Rick Simpson. I don't know if many of you people know Dr. Rick Simpson. But he's basically a medical doctor from, I don't know, the 60s or 70s. I don't really remember. But he got a traumatic brain injury and he was really dizzy and no one could really help him. And so he started smoking pot and it helped his symptoms. And so then fast forward, he actually got skin cancer. And so he boiled this stuff down. He made what's called, to this day, it's called RSO oil, for Rick Simpson oil. And he put it on these lesions and actually cured the skin cancer. So that was kind of my first introduction to THC for medical use. But, obviously THC has been used for seizures. It's been used for traumatic brain injuries. It's been used for several different things, pain, all these things. The main thing is it can drive up anxiety in some people. Some people tend to react very well to it. If you're going to do it, my recommendation is to start with a low dose of it and just titrate it up. Whenever I've seen kids that have had brain injuries, whether they have seizures or not, start to do this. And again, this is a decision that you as a parent need to make and that I as a medical practitioner in the state of Texas cannot make. But if you decide to go down that road, I can tell you that I have seen kids that actually do very well with it. To my knowledge at this point, thinking about it, I can't think of any that, just really did not do well. And when I say that, I mean, had a spike of seizures and that sort of thing. My first thing that I would recommend to do would be to increase the dosage of the CBD perhaps, and try that route. But, I think if you wanted to give the THC a try, I think that there's enough information out there to support the use of it. Again, just start low with THC and titrate up. Do you have anything to add to that, Ryan?
Yeah, I think it's really depending on, what you guys are okay with. I know, with like Charlotte's Web, they used THC, and regarding like tinctures and oils that do have THC, kind of like what Dr. Crawford said, you can have ratios of higher CBD to THC. For me, I prefer the no THC whatsoever, just because I'm kind of like a lightweight. I'm just super like sensitive to medications and stuff like that. But it really just depends on what you're in line with, and then just finding a good company that does have THC, and trying to find a ratio that works. I think that's the toughest part, is just trying to find out what works best for your loved one.
Yeah. Okay, so next one. My son Preston drowned the 4th of May. Sorry to hear that. We're currently at TCH downtown Houston. He's on a vent getting a trach soon. We pray a miracle happens before he needs a trach. I agree, man. He's 2 years. Let's see. Next one here. What are your thoughts on strains of CBD, specifically sativa and indica? Okay. So one of our formulators, that we use, his name's Tad. He could go off on this question for hours and hours and hours. He's got like a freaking PhD in chemistry. Basically, the strain of the plant is highly dependent on the company that you're getting your product from. And here's how I want to explain that. So, and I'll speak about our product line. The strain of plant that we use in our product line has been meticulously grown and analyzed for, gosh, I don't even know how long Tad's been doing this, a decade maybe? I don't know. But he's been seriously refining this process and refining this plant for a very, very long time. And so, if you were to ask him, hey, is this sativa or indica? Well, it's a hybrid of both. And what he's trying to do is get a balanced cannabinoid profile. And so that's really what you want, is you want a good balanced profile. Obviously, your terms of, indica is, indicouch, and sativa is the one that kind of, gets you up and going a little bit. I don't know that really carries a whole lot of truth. And to be honest, it's really going to be based on your own biological makeup, how you respond to those things. So that's my comment on that. Tad could go on for a long, long time on that. What do you think, Ryan?
Yeah, I mean, I don't have too much to offer on that, so I'm sorry. Or for the next question regarding like specific terpenes. But I will say, like, finding a good product that's third-party tested, because part of the problem is like a lot of CBD right now is kind of unregulated, in the sense that, they've done a lot of batch testing on just randomized companies, and they found like some companies didn't even have CBD when they said they did. Some didn't have THC when they said they did. So yeah, I don't know. I don't want to go off on anything. I don't know how to answer. Stephanie.
Sure. Stephanie says, any specific terpenes for seizures? So here's what I'll say is that what I've been seeing for seizures, some people respond very well to CBD, just straight CBD. Obviously not straight as in a distillate, but high dose CBD. Some people respond well to THC. And there's another thing coming out called CBG, which is a component. Obviously, it's a cannabinoid. I'm not well versed in all the terpenes per se, like the ones you're specifically asking about, but I know that CBG, actually, there's some good research coming out on that, which is, referencing our formulator again. He's actually formulating a product higher in CBG for that reason and for a few other reasons. But I don't know if I could give you an exact answer on a terpene for seizures per se. And, honestly, I don't know if that information is really out there. Have you heard anything on this?
No, but regarding CBD and terpenes, I think the most important thing, from my understanding of the research, is isolated CBD isn't as effective as a broad spectrum, which includes terpenes. That's where you get what's called the entourage effect. So it's kind of like CBD and its buddies grouped together to have a more powerful impact on the body and the system. So I don't know about the specific terpenes for seizures, but I do know that finding something that's either broad or full spectrum can have a more positive impact on the system.
Absolutely. Yeah, I totally agree with that. Kelly, my other child is 10, is healthy, but does have ADHD, takes Vyvanse, but would CBD oil help better with him without the side effects? Absolutely.
Yeah.
Like I heard Dr. Cedermark, say earlier, so I've got, speaking of ADHD people, there's Dr. Kyle Daigle calling me. Sorry.
Well, Kelly, my little brother, he and I both have ADHD. He was a little worse than me. He was taking medication for it. And so I actually, like the CBD that we joined with Johnny Grant, I sent him a couple bottles, and he now just takes that for his ADHD. He's working in a hospital, and he said that the CBD helps him a lot better without the side effects of his ADHD medication. He does take his medication sometimes if he's having a rough go at it, but most of the time he's just using CBD. And again, we didn't know about this until a year ago. So, and he's 31 now. So he really likes the CBD for ADHD.
Right. And just to kind of carry this conversation beyond the scope of CBD, ADHD is going to be an imbalance in the brain where, there's two networks. There's a right dorsal lateral prefrontal cortex and there's a right orbital frontal cortex. And these are the areas that are really affected with ADHD. So you get this, lower right brain type of kiddo or person, adult at this point in time, where you kind of lose that inhibition, you lose that global ability to focus. And, that's basically what ADHD is. So while, CBD is fantastic and has a great systemic effect and all this kind of stuff, you do want to make sure to pursue, something in the developmental functional neurology paradigm, something like what Dr. Robert Malolo's developed. That's what I do, Dr. Cedermark does, Dr. Kyle Daigle, like that's what we do all day, every day, is we work with, people with these developmental issues going on. And so, ADHD, I see it very, very often in my office, and we get phenomenal results whenever we do, we take the developmental functional neurology approach. We use CBD, we use laser therapy, neurosensory integration, all that kind of stuff. So I just wanted to kind of take that a little step further. Let's see. So, the next one, what's the best CBD oil to get for anoxic brain injury? I want to be just completely blatantly honest with this. And the answer is, it really depends on what you respond best to. And you're going to have some trial and error for that. Like I said, myself and Dr. Cedermark, we have ownership in a product line, the Stay Strong Johnny Grant product line. And you can find that if you go to the Brain Chat website. So go to thebrainchat.com. And over on the top right, you're going to see a menu. You click on the menu and it drops down and you'll see a hashtag Stay Strong Johnny Grant CBD. That'll take you directly to, the website that has this stuff. Obviously, you heard my story. I've tried a lot, not just with myself, but with my patients. I've always seen pediatric patients. I've always seen brain injuries. I've always seen these things. And so, like I said, I'd pretty much stopped using CBD because I was not getting results until I started using these higher dosages. And then that's how this whole, label came along, if you will, is we needed something that worked for brain injury. I mean, that's why we had to, like, for example, we did have the highest dose broad spectrum product on the market with the 7,000 milligram. As of today, we now have a 10,000 milligram bottle, which is way, stronger than any other product out there. And it's just, again, it's results driven. So, that's what we think. We think that what we have is the best. But again, there's going to be some people that respond better to other products, and that's okay. And it's going to be some trial and error to try and get there.
Yeah, I've had some patients say, is there any THC in this stuff? Because they want the THC too. So,
right. Which CBD we prefer for severe global brain damage? So I'm going to just, reiterate basically what we just said. I would probably go with the Stay Strong line that we have. I would start with either the 5,000 or possibly the 7,000 milligram bottle. And I would start with half a dropper twice a day is what I would do for that. You can do it in a G tube, that's fine. Preferably you go under the tongue, hold it there for 20 or 30 seconds. But again, you can put it in the G tube. All right, let me see here. So okay. Justin's at the hospital right now with 2-year-old Preston. Okay, gotcha. All right. So, yeah, so the boy tubes are just telling me a little bit about you, Justin, about how you're in the hospital right now. Okay. They're not giving you much hope. Man, I don't know, man. I want to help however I can. I hate to hear this for sure. Obviously, yes, CBD can be an option for sure. Absolutely. I think I need more details, and, maybe we can dialogue a little bit more about that after the call. Okay. So let's see. All right. More dialogue here about that. All right. All right. I'm reading through these comments. All right, so let's go down to Rachel. So Rachel, my daughter's 19 months old. She's on baclofen and Keppra. She's also super tense, constipated, etc. I've read that one of the side effects of baclofen is constipation, which doesn't help the brain injury gut issue already. I don't know what dosage or to find the information to get the CBD realm for her. Okay, so dosage on the CBD. Again, this is going to be very different for everyone, but from, again, my experience, the higher doses work better, especially in this realm. So basically, I'm going to say, same thing what I said earlier. Start with either the 5,000 or the 7,000 milligram bottle, and start with half a dropper twice a day. I think for the more severe type of situations, or if we're dealing with constipation or something like that, and she's very tense, obviously, you're about to do the baclofen and whatnot, then that's a good place to go. Do you have any more info on that, Ryan?
No, it can help, like adding CBD into it. So, sorry, I kind of missed what you said. I was reading another comment.
Don't worry. I think we're good. I think we covered it. Okay. So, Frank,
CBD can help with constipation, though.
Say again.
CBD can help with constipation.
Got it. Yeah.
It can help increase GI motility. So.
Right. Where'd my chats go? There we go. All right. Hold on. It just disappeared. I got to pull it back up. Frank. Okay. Doctors, how long would we need to use CBD product before we see a positive response? So what we need to do is we need to kind of push a train back up the hill in some instances, right? So we need to slow down this cascade of events, and then we need to allow for some healing to take place. And then we need neural integration on top of that, right? Because we're talking about, a brain that's been injured, and sometimes rather severely injured. And so basically, we need to stop a process, we need healing to take place, and then we need integration in these networks. And that's where, the functional neurology component comes into play. If you want to tune into Brain Chat, or, Dr. Cedermark talks all about that. So that's pretty cool. But, that's basically the answer there, is that it can take however long it takes to get to that point to where we really start to rehab those networks and start to see them begin to integrate. Sometimes it's very quick, sometimes it's not so much. What do you think about that, Ryan?
Yeah, I agree. Depending on level of injury, of brain injury and the symptoms, there's something that it's called endocannabinoid tone. So if you lose that tone, you may have to build it back up. So it may take a few days, it may take several weeks. That also all depends on dosage as well. So it is something you do have to kind of play around with, but a good starting point that we know of with our product would be kind of like what you said, like a 5,000 or 7,000 milligram dropper twice a day to start, to see if that has an impact.
Right. Rhonda says Yvette would like to know if CBD could replace a muscle relaxer medication such as baclofen. That's kind of a tricky question for me to answer. I don't want to say that it'll replace a medication. What I can say is that it would support the systems so that perhaps less of the medication would be needed and perhaps not be needed, right? So, that's how I'd like to answer that. And Ryan's got more information on medication than I do.
No, that's exactly how you kind of have to look at it. And then also, a lot of medical providers, traditionally, they're really not going to know too much about CBD. So if you do ask them like, hey, we started on CBD, I'd like to try to wean off baclofen. If you can just get them on board, it's definitely a possibility, but I wouldn't say that it replaces a medication like baclofen, because for like certain spasticities and stuff like that, baclofen serves an important purpose, especially in the acute stages of an injury.
Okay, my son has an absent seizure. I've tried different CBDs, but feel they increase the seizures. Any thoughts on why it would be increasing the seizures? We also are currently weaning off Keppra. So one, I don't know if you want to speak to this, Ryan, but basically I've seen, as you wean off of Keppra, I've seen transient spikes in seizures.
Yeah.
That's even on the label. Mm-hmm. So, that's one thing to consider, that as you're weaning off an anti-seizure med, you may actually see spikes of seizures. But the thing about this is that if you've tried many different CBDs, number one, again, going back to what we said earlier, make sure they're broad spectrum, make sure it's not just a distillate or an isolate, and give it time. So remember, treat this more like a nutrient. Give it 30 days, 60 days before you really judge, how that's going to affect. And you can, if you're scared, with the seizures, which is understandably so, that's fine. Start with a lower dose. For us, we've got a 1,500 milligram bottle. Start with that. I'm one that likes to see results fast, so I plow right through, into the higher dosages. But if you're a little more concerned and you're not, you're a little worried about the seizures, then start with a lower dose. The way I talk about seizures is abnormal electrical activity in the brain. The electrical activity in the brain dictates our function. So as we start to alter brain connectivity and brain function, we can see some transient spikes in seizures, because in these types of brain injuries, there can even be sclerosis, which is scar tissue in the brain that can cause like a misfiring. There can be just, dead networks and neurons, which can cause a misfiring. And so that can produce abnormal electrical activity in the brain. And then as we begin to rehab it, what we're seeing as seizure activity may actually just be the brain starting to rewire, as long as it's only transient. If it's prolonged and it's not changing, then that's a problem. But do you want to add anything to that, Ryan?
Well, I would say too, with absent seizures, they're kind of a different beast. So it may be that you do have to start with a lower dose, because in my mind, the way I see absent seizures is when you look at like the vagus nerve and the way that the brainstem is communicating with the brain, shutting down the system too much can increase the activity of an absent seizure. So, and CBD can do that, because CBD is really good. It's kind of like that one essential nutrient that kind of helps balance out and regulate and slow down things. So it may just be that there was too much in that specific dosage of those different CBDs. So I would start with a much lower dose and maybe even go lower than you thought. And I'd also, you have to be careful with these anti-seizure medications like Keppra and Depakote, because they are processed through the liver, and some research shows that CBD, it can kind of prolong how fast your body metabolizes those medications. So kind of going into the next question, it can increase the efficacy of that medication as well, because it's taking a much longer time to go through your system. So you do really have to be careful if you're trying to, slowly wean off of especially a seizure medication while you're taking CBD, because of the changes that it has on liver enzymes. I don't know if that answered that question, but absent seizures, and in my experience, I've only worked with a couple of patients with those with CBD, and they're a little bit different than like the epileptic seizures and stuff like that. So in my mind, it's almost like you're kind of like you'd have to start with a much lower dose. In summary,
Absolutely.
try that. Yeah.
What do you think about the next one, Ryan? Is it possible to give too much CBD? Can one overdose?
So from everything that I've read and everyone that I've worked with, no. I mean, you can have increased, I guess you would say, symptoms from the CBD, but I'm like with 99.9% certainty that you cannot overdose on a broad spectrum CBD with no THC. If there is THC, you definitely can overdose with the THC. But with just a broad spectrum CBD, 0% THC, I haven't heard of any episodes or any reports of overdosing. I don't know about you.
Well, and no, I totally agree that I have the same answer. I've even looked at, can you overdose on THC? And, I haven't found anyone on record, any type of death associated with a THC overdose.
Yeah. Sorry, not in that sense, but like symptomatically, like.
Right. You'll fall asleep and then be very hungry, but that's, no, I'm kidding. But yeah, you'll basically pass out. I mean,
or anxiety, like you said, different strains and strengths can cause anxiety.
Absolutely. So, yes, so there you go. So how long after beginning CBD would you expect to see results for seizures and inflammation if dosing is correct? I've seen it as fast as the next day, and I've seen it take up to 90 days. Do you have any comment on that, Ryan? Because I think it's just so dependent on the person and the situation.
Yeah, I mean, it's just something you kind of have to keep an eye on. What medications is the person currently taking? What are they not taking? So it just depends. But CBD, if you take it pretty consistently within the system, after a few days, if there's unwanted or persistent inflammation, it should start to slow those systems down.
Cool. That next one's a question for you, Ryan.
So what kind of brain exercise? So we do. So there's within chiropractic, both Dr. Crawford and I, we practice what's called functional neurology. So it's basically like brain rehab. So there's specific neurological exercises based on symptoms for the brain. So that can look like doing vagus nerve activities. It can look like doing different types of balance exercises. So it all just depends on the patient. And it may look very much sometimes like a physical therapy, but with kind of a more special focus on different regions of the brain. I don't know if that answers your question.
Yeah. So, basically in functional neurology, what we do is we find the weak areas of the brain and we do whatever we got to do to make them stronger. I mean, that's really, what it boils down to. So, again, something that you might want to do if you're really interested in this kind of stuff is checking out, thebrainchat.com and check out some of the stuff that Ryan talks about. He's got some really, really cool information, and he's a really good teacher, by the way. Ryan's a phenomenal teacher. And once you really start to hear him talk about these really complicated systems in the brain and everything and how he breaks them down and teaches them is phenomenal. So I'll go ahead and say that for you, Ryan, because I know you won't say that otherwise. So would you provide dosage? So you've heard me say a few times, start with the 5,000 or the 7,000 milligram bottle and start at half a drop or twice a day. That's what I personally do in my office for the majority of brain injuries. For the average, non-brain injured person, I tell them to either start with the 3,000 milligram bottle, or if you're more sensitive, like Dr. Cedermark, go with the 1,500 milligram bottle. Yeah. But that average person, typically can start with the 3,000. But again, with the brain injury, you might want to start with the 5,000 or the 7,000, and then that'll leave you room to go up or down as needed. Again, dosage is going to be highly dependent on the individual, and there is trial and error. There is. I mean, I wish I could give better information on dosage, but that's really just the truth of it at this point in time. Let's see. Okay. Going through here. Sorry, I'm going through the comments here. Okay. Michelle said her son who has a TBI is on a broad spectrum CBD. MD and others CBD is natural. She can't tell if she's been giving him too much. He has really been dysregulated lately, easy to explode. You recommend a low dosage to start and build from there. I mean, yeah, if you started out, I don't know what dosage you're using or what that looks like, but you can always be changing that dosage and seeing. Now, something else to consider. I see easy to explode. I don't really know what that means, but again, I've seen in my practice, which I see a lot of pediatrics, our kids have been heavily affected by all the stress going on in the world right now. Even if your child is brain injured, they still have an awareness. They still know and sense things that are going on around them. There's a high level of stress right now. That's going to have an effect on them. So it may not just be the CBD, or maybe it is. I'm not sure. I'm just putting this out there that there may be other variables involved that you might want to consider. But absolutely, continue to play with that dosage and see if you can find a right one. Give it 5 to 7 days and then increase the dose. Do you believe absent seizures damage the brain when they are seconds long? What do you think about that, Dr. Cedermark?
I don't. So I think an absent seizure is a window into a brain that is damaged. So yeah, I do. If they continue to occur, depending on how long the seconds are and all that, I do think it can further. It's not good for the brain. I guess I would say that. And it is a sign of a brain that does need some sort of healing and attention. So you don't want them to come frequently, and you don't want them to last long at all by any means.
Correct. Right. And, if you look at what happens, they typically define what's called sclerosis, which again is like scar tissue in the brain. And so that's really what you see with these chronic seizure disorders. So again, seizures are abnormal electrical activity in the brain. And while we want to see it go away, it can cause some damage over time. So
I think another good thing to say about that too is when you look at a brain injury, if you've heard the term of neuroplasticity, when it's spoken about, they usually speak about it in a positive way. So building a brain, but you can also develop what's called negative plasticity, where these pathways, so like a seizure pathway, it just becomes more traveled and more efficient the more it occurs. So it almost becomes the new norm for the brain. So if they are happening more and more and more, I would describe that as like a negative plasticity, which means that the brain is kind of going down that route a little bit further, and something does need to change to help turn that around.
Right. Very good point to make. Yeah, absolutely. And, since you brought that up, cannabinoids have actually been demonstrated to promote positive plasticity within the brain, to build new neural connections, to build new neurons and those sorts of things, right?
Yes.
Yeah, absolutely. Okay. Let's see. Our CBD bottle says it's less than 0.3%. Is that more than your product contains? So our product is actually absolutely zero THC. So I think that's what you're referring to as THC. But
yeah, and some bottles will say 0.3% because that's what they have to have labeled as to be able to be sold as like a hemp-based CBD oil, I believe. Like they can only have it can only be up to, I think it's 0.3% or 0.03% of THC to be able to be sold as a non-THC product. And that's just kind of the balance of the plant that product is made from, I think. Is that correct? Or
I was reading the next one. I wasn't listening to you.
Yeah. If it's it is more than ours contains, so it may have a little bit of THC in it. So yes, short answer.
Yeah. So the Stay Strong line has zero, and that's third party verified. There's absolutely no THC in it at all. The last question here: do you suggest weaning off seizure meds before starting CBD? My daughter's on she had an avian rupture, stroke survivor, age 5, not 10. Do you want to tackle that first, Ryan?
Yeah, I mean, I can't really recommend that. That's a conversation that I would definitely have with the neurologist, that whoever prescribed the medication. I think that you can start taking CBD at a low dose to try to build up the endocannabinoid tone or the endocannabinoid system before completely taking them off. And I think it would support the system in a positive way, but it's definitely a conversation that I would have with the prescribing physician.
Yeah.
Yeah.
I totally agree. I totally agree with that. I had a conversation the other day about a doctor basically saying, don't try CBD. It's going to harm the brain or something like that. Yet they were upping the Keppra dose. I'm like banging my head against the wall, but whatever. So someone says, what's the difference between storming and seizures? So there's a lot going on in the brain when, someone with a brain injury storms. That's why they call it a storm. It's similar to a seizure, but typically, not always, typically this is going to be more of a global response going on in the brain. And it's very similar to a seizure, obviously abnormal electrical activity, but it's not the same as a seizure. I don't know how to communicate this, Ryan. Do you have any ways to really talk about this?
I think if you, with storming and seizures, I think if you think of kind of like a Venn diagram, there's so much that kind of coincides with each other. They are two different conditions, but in a similar sense, it's a brain that's not working as well as it should be. Obviously, with seizures, you can sometimes pinpoint the exact brain area where it's kind of coming from. But like you said, with storming, that's more of kind of a global brain injury. So they're two different conditions with some very similar symptoms.
Right. So what if a neuro is not on board with CBD? I mean, if your neuro is not on board with CBD and they're not willing to give it a try, then you may want to consult or get a second opinion from someone else. I mean, that's the best answer I have for you, just to be honest.
CBD works, and like I said, like it's a very hot thing right now. But the research, this is something that's been researched for a really long time. There's groups at big institutions that are funded to just do more and more research because they know how well this system works. People just aren't trained in it. Medical professionals are just not trained in CBD and in the endocannabinoid system. So honestly, they may not even know. Like, they just may not know, and they'll just brush it off and act like it's nothing. But it's something that could really help.
Right. Absolutely. Yes. Thanks for the information, Frank. Absolutely. Storming is a full, autonomic response, often prolonged. Seizures are more specific. The CBD help with storming, I've seen it help.
I don't know. Yeah, that's you.
Yeah, I've seen it help, but I've also seen it not help. So I'll definitely say that as well. I think it depends on the degree of the severity that's going on. So yeah, I agree. We need a second opinion. Yeah. I've heard some really bad stories out there about the medical neurologists right now. Look, they're out there. I know that there's a need for them, and I know that they need to, be in the hospitals and save lives and those types of things. But when it comes to these types of things, they just don't have the information. So, definitely finding someone that does is very, very important. So,
yeah, there are progressive neurologists that are using natural ways to help heal the brain. It's just sometimes it comes down to training, and yeah.
Absolutely. Okay, well, cool. That's all the questions I see there. And so it's been a little over an hour, so that's perfect.
Thank you so much, both of you. We so appreciate you guys being here. And I wanted to say, if anyone has any suggestions on future topics, to please email me. I'm always looking for some good topics to have for you guys. So, thank you.
Absolutely.
Same prayers for Preston.
Yes, absolutely.
Take care.
All right. Thanks, guys.
Thank you.
Bye.